Today we will be presenting on the winged scapula. I'm Gabby Morano.
I'm Lexi Giese.
Casey Dravis.
All right.
So moving on to the review of the scapula, the motions that are involved are abduction or protraction, adduction or retraction, elevation, depression, upward rotation, and downward rotation. So when an individual experiences scapular winging, they might find that they have the most difficulty performing activities that involve abduction in both upward and downward rotation.
Alright, so a little bit of a background on the winged scapula. The winged scapula is a very debilitating issue, musculoskeletal issue. The main muscles that are involved are the serratus anterior, the trapezius muscles, and the rhomboid muscles, major and minor. This is characterized by a failure of dynamic stabilizing structures that keep the scapula anchored to the chest wall, leading to prominence of the scapula. Protrusion from the scapula's normal anatomical position on the posterior thoracic wall. So it pretty much is just a protrusion of the scapula where you wouldn't normally see it. The main abilities that this affects the person is with lifting, pulling, and pushing objects, as well as ADLs and other associated occupations. The population that this is most commonly affected are athletes and labor-intensive jobs like mechanics, welders, and carpenters, because the athletes and these labor-intensive jobs have a lot of repetitive motion, causing for the chronic issue of this. And treatment can take up to 2+ years, and it may involve surgery. So with the etiology of the winged scapular, this can be chronic, acute, or idiopathic. So the chronic kind of lays into the repetitive movements, like an athlete has for whatever sport they perform, and also household activities like brooming, sweeping, really anything that has a lot of repetitive motion as well. That goes with the jobs too. So a carpenter doing his job and with all the repetitive movements, welders, and so forth. The acute phase of this injury happens with blunt force trauma. So again, maybe an athlete takes a really hard hit, or someone is working a construction job and gets hit by the equipment or anything like that. The winged scapula can result from this. And then also idiopathic, some illnesses may lead into this, unexpected muscle ruptures of the shoulder muscles, as well as other shoulder instability from other musculoskeletal conditions. Most cases involve lesions to the nerves that are involved with the muscles. So the serratus anterior, the lesion to that would be the long thoracic nerve. If it's the trapezius, it would be the spinal accessory nerve, and if it's rhomboids, it'd be the dorsal scapular nerve. The winging is a direct result from unopposed forces on the non-palsied muscles. So if the serratus anterior has palsy, the trapezius and the rhomboids will be pulling on it because they are not affected. So that's where the actual protrusion results from.
Okay, to reiterate what Casey was saying, the muscles that are involved are the serratus anterior, the trapezius, and the rhomboids. These muscles are responsible for providing the necessary scapular rotation, tilting, and abduction that allows for full range of motion of the upper extremity. And they work together, as Casey had mentioned, to anchor the scapula to the posterior wall. The serratus anterior is the most common muscle affected in scapular winging, and it's caused from damage or impingement to the long thoracic nerve that causes winging of the medial border. And then in less common cases, it affects the trapezius and the rhomboids, which is damage and impingement to the spinal accessory or dorsal scapular nerve, which causes winging of the lateral border. While these muscles and the specific scapular motions are most affected, when these structures are damaged or paralyzed, it can also cause problems like weakness or pain to other motions like shoulder flexion. So this picture is just showing you the different kinds of wingings. On the left, you see scapular winging caused by paralysis in the trapezius. So you can see that lateral border protruding. And then on the right, scapular winging caused by serratus anterior paralysis, so that medial border. And then this picture is just showing how long, well, it's a long thoracic nerve, but it goes right through the serratus anterior. So if that's damaged at all, it can have detrimental effects on the muscle. So as it goes to occupations affected, this kind of injury can affect a lot. So with ADLs, a lot of the self-care occupations like showering, brushing teeth, brushing hair, they may be limited or can cause pain. You can see lack of endurance. So brushing your hair really might feel like you can't hold it much longer. And brushing your teeth can be painful, showering, getting your hair washed. IADLs, this section kind of depends on the types of roles the individual might have. But if they are an adult and they have their own house, cleaning the house, grocery shopping for themselves, preparing themselves meals, those can be affected. But also if they're a caregiver, especially of like infants or toddlers, having to carry them a lot, that can also be affected. As for work, leisure, rest, and sleep, these all kind of depend on the individual. As Casey mentioned before, for work, jobs like construction work or labor-intensive jobs can cause this injury, but they also will be affected if they have this type of disruption. So like CNAs, UPS workers, construction workers, they might have to reconsider their job or at least figure out a way to perform their job differently. With rest and sleep, individuals might have to reconsider their sleep positions. I'm actually somebody who falls asleep with my arm over my head for some reason, but I wouldn't be able to do that if I had scapular winging. For leisure, individuals might not be able to participate in their favorite leisure activities that involve the upper extremity, so sports, painting, shopping, etc. This is really detrimental to athletes, especially if the serratus anterior is affected, because that is a muscle that helps perform most actions in most sports, as well as the scapula. And it's also important not to overuse or overstretch the shoulder after onset of winging. The pain might cease and it might disappear, but the weakness will still be there, and just because the pain is gone doesn't mean it's not damaged, and using it more could cause more damage.
So moving on to the treatments for this, I broke it down into two. So I did the OT specific treatment and then the one that's used universally. So starting with the OT specific treatment, the one that we had chose was created by Watson and Shrinkin. So this is broken into 3 stages with treatments for each stage. So starting with the first stage, or the acute stage, it focuses on pain reduction and range of motion, but then in addition, it also focuses on activity modification because that's important to prevent further injury. Next, moving on to the second stage, or the intermediate stage, this focuses on passive stretching of the pectoralis minor, rhomboids, and the levator scapulae muscles to maintain full range of motion and prevent contracture of these muscles. Next is the third stage, or the late stage, and this focuses on the improvement of the shoulder mechanics and then strengthening of the serratus anterior muscle. This is due to implementing the strengthening exercises of those shoulder girdle muscles because it's important during this stage to avoid overstretching the serratus anterior muscle. Moving on to the treatments that are used universally, they vary on the type of palsy that we had mentioned previously. So if there's serratus anterior palsy, this is a conservative treatment that is used. For the trapezius palsy, they focus on nerve repair and they still follow through with the conservative treatment, but if it is a chronic winged scapula, then they look into surgical explorations to fix that. And then lastly is the rhomboid palsy, which is also a conservative treatment, but the same goes. If it is a severe case, then surgical procedures are needed.
Alright, and then here's a video that we have prepared featuring the long thoracic nerve injury, so this would be involved with the serratus anterior, the main muscle that is affected, or most common.
Okay. This is, keep going up. Once you get all the way overhead there.
You can see the medial border on this side a little bit.
My muscles almost started cramping up on the right.
It did?
From like trying to like push it up further.
Where were you feeling that?
Like in here.
In the back there?
It started on.
Okay, gotta do a wall push up now.
It's very prominent in this one.
Nice and slow. Okay. And let's have you go down and do one more nice and slow.
So you can actually see, it might be difficult to see on the video of the video. Oh no, what did I do?
Okay, come back up.
So the person conducting the test had drawn little lines where the scapula would normally be. As you can see, it's very prominent and coming out of where it normally would sit. So that is all we have prepared. Thank you for watching, and if you have any questions, drop it in the discussion and we'll be happy to answer them.
Thank you.
Thanks.